Stroke. It's a nasty little word to hear, everyone. And we're going to start this hour on 882 6PR with that going a little bit serious for you. So some recent reports have revealed that in 2023 there were 45,000 plus Australians who experienced a stroke. Now that is one stroke every 11 minutes, and the projections indicate that this number could actually escalate to 72,000 strokes annually by 2050 if we don't take some sort of immediate action. So what sort of action should we be taking? Is it prevention? Is it treatment? What do we do here? I've got Dr. Liz Dallimore, who is the CEO of Argenica Therapeutics, to join us. Now, she is not only a leading neuroscientist, her company, Argenica Therapeutics, is at the forefront of developing innovative treatments aimed at reducing the brain damage following a stroke. And we're very lucky to have managed to get hold of her today to explore this alarming incident in the increase in the number of strokes. Because where are you today, Dr. Dallimore?
Hi, Chrissy. I'm actually overlooking Geordie Bay at Rottnest Island. So absolutely stunning day looking out there at all the magnificent vessels that are coming in for New Year's Eve. So it's lovely to be here, but even better to be joining you and I think talking about this really important topic.
Thank you very much. Let's talk about the recent statistics on stroke incidents in Australia, because they really are alarming. Can you provide some insight into the primary factors that are contributing to this increase?
Yeah, look, it is quite alarming. I think the previous report that the Stroke Foundation put out was one stroke in Australia every 19 minutes. The most recent data shows us that this is now one stroke every 11 minutes in Australia, which really is quite terrifying. So, look, there's a number of reasons. Obviously, ageing population kind of contributes to that. We know there are some risk factors associated with stroke around people's lifestyle, smoking, those sorts of things. So, you know, a number of things that sort of contribute to it, but it's probably going up faster than I think we had anticipated. You know, and interestingly, in other countries, I've just returned from a trip to China. Stroke is now the number one killer in China, so even more so than heart attacks. So it is becoming a really significant health concern.
Yeah. I mean, in your role as a neuroscientist, if there was something that you were going to do to protect yourself, have you figured out what it is?
Yeah, look, it is hard. Obviously, having that healthy lifestyle is really important in terms of diet, exercise, those sorts of things. But really, I guess what we're really focused on at Argenica is looking at what the treatment options are for people with stroke, because it's going to be really hard to obviously eliminate people having strokes. So really we're looking at, okay, what can we do then to improve the treatments for these people so that following a stroke we can protect the brain cells and we can give these people a really good chance of recovery back to sort of how they were pre-stroke.
So what's the current treatment? If you suspect someone has a stroke, what should you do and what's the next step?
Yeah, so if you suspect someone having a stroke, so the Stroke Foundation has some fantastic sort of material out there around the key signs to look for. So the typical telltale signs around speech, droopy face, those sorts of things. So the aim is to call an ambulance as soon as possible if you suspect someone of having a stroke. Because time really is brain. So we know that around 1.9 million brain cells die every minute post-stroke. So the aim is to get that person into hospital as soon as possible so that they can get the treatment that they need. The challenge at the moment is if someone is suspected of having a stroke, the ambulance doesn't know what type of stroke that patient is having. So around 85% of all strokes in Australia are caused by a clot in a blood vessel in a brain, which is called an ischemic stroke, and around 15% are hemorrhagic strokes, which is caused by a bleed on the brain. But that has to be diagnosed in hospital. So all that sort of time while the patient's waiting for the ambulance to arrive, to get into hospital, we have those 1.9 million brain cells dying every minute.
It's like a little domino, isn't it?
Yeah, it is. And it's kind of what we call this kind of cascading out of the brain injury that you can sort of see on the brain scans of these patients. So we're trying to develop a treatment at Argenica that could potentially be delivered by paramedics in the ambulance, by those first responders that arrive to that patient, and be able to give a drug which can stop that brain cell death sort of in its tracks. And buy that patient time to get to the hospital and the treatments that they need. And by stopping that sort of cascading out of brain injury, we anticipate these patients will have much better recoveries post-stroke.
Can you elaborate on the trial, the trial where the drug is actually at the moment?
Yeah, sure. So we're currently conducting what's known as a phase 2 clinical trial at 10 sort of tertiary sites across Australia in emergency departments. The patients, so what we have to do in this phase 2 trial is really we need to make sure the drug is safe to deliver to patients having ischemic stroke, so the clot-causing strokes. And so to do that, we do need to deliver it in the emergency department. And then we're also really looking for signs of efficacy. So how well is that drug working at protecting brain cells? So in Perth, we are recruiting patients at both Charlie's and Fiona Stanley. We've dosed a number of patients at both those hospitals. And we are coming to really the tail end. We've only got a few more patients to dose in that phase 2 trial. So we anticipate that we'll know how well the drug is working and how safe it is sort of by mid-2025. So just around the corner, which is really exciting. And look, the amount of research that we have on the drug, the drug has been in preclinical development at the Perrin Neuroscience Research Institute there on the QE2 site for over a decade. So, we have a huge amount of confidence that, we really do think that this drug therapy could be an absolute game changer in stroke, which is very exciting.
So what are the key milestones you need to reach now then for this product, this drug to be available?
Yeah, so this phase 2 trial will give us the confidence to take the drug into what is the final phase of clinical testing, known as a phase 3 clinical trial. That is a global trial, so we will need to set up sites across the world, so the US, Europe, probably China, Japan and Australia. So have a big diverse population, really to prove that the drug does work at protecting brain cells following stroke. And then following that, it will do all the application to get the drug approved and available to patients as soon as possible.
Yeah, it really, really interesting, and it could certainly transform stroke treatment here in Australia and globally, couldn't it?
Yeah, absolutely. If we could, if we could really prove that this works after all this research and the hard work that all the scientists have put in, to be absolutely bananas if we can get that done. Yeah.
Well, Dr. Liz Dallimore, you deserve your couple of days off. Thank you for sharing a little bit of time with us, and we really appreciate it.
Thanks so much, Chrissy. I appreciate it. Thank you.
Happy New Year. Dr. Liz Dallimore talking to us about the fact that there is this ridiculous increase in the number of us experiencing a stroke, 1 every 11 minutes. At the moment, there's nothing to really stop that cascading of the brain cells as they die. So her company, Argenica, has been looking at ways of stopping this, and it could provide, it just could transform stroke treatment in Australia and globally. And if you want to read a bit more about the company, it's Argenica Therapeutics. You're listening to 882 6PR. It's 16 minutes past 12.